So, firstly, welcome to the first day in the course, 10-day course of the full course. It's 10 days, and then there's more as well. There are supervised mocks and supervised sessions, practice sessions, workshops for talking mannequins, workshops for prescriptions, workshops for all other mannequins and examinations. It's a total of 18 to 19 days. And so these initial 10 days will be to cover all of the different kinds of situations and scenarios that you can find in your Plab. Now, I put over here, hello, my name is, because I want you guys to know that that is how we do it in the NHS. Hello, my name is. Introduction. That is how your Plab 2 journey begins. It is making sure that you introduce yourself to your patients, that you treat them with dignity, being polite, and being very good-natured, building rapport as well. We're going to talk about those things in a second. Just a little bit about my team as well as part of this first day. Number one, Dr. Zishan, the founder of UK Pass Academy. You'll meet him later as well. He'll take the second part of this first day. The sessions will run at 4 hours, then 1 hour lunch break, and then another 4 hours. So the classes will end around 6:30 and the start time is 9:30. So usually we're going to be dividing our days with Dr. Zishan and myself. Dr. Zishan has been teaching for a very long time, and I can't wait till you meet him. About myself, I'm Dr. Radwan Ali. I always like to say, believe in yourself and be kind to yourself. I have had 5 years plus experience in tutoring and mentoring in the Plab 2 and the Plab 1 as well. It was my pleasure to be a part of, the success stories of many doctors who know me until this day. And I graduated from Hubei province, Wuhan University in China. And I have had significant experience working outside of the UK in Uganda, in Somalia, and all over the world, China as well. I then made the switch to the UK, did my Plabs, got my registration, and I've decided to continue with my master's in education, and I am doing that while I also take part in this project for UK Pass Academy. But enough about that. I'm sure we're going to get to know a lot about each other. Now, I want to save time, so I won't go too much into the UK MLA map content because the reality is we did a webinar already about that, and I've also made a separate video talking about the UK MLA Plab 2 changes. So today we're not going to focus on that, but I do need to make sure you understand one thing, and that is that, just a second, let me... Okay, yeah, and that is just one aspect that I need you to know. There are not many changes. Plab 1 will keep its name. Plab 2 will also keep its name, okay? The domains that are being tested, the GMC, even before the MLA content map, used to test these areas already, okay? So you don't have to worry too much about that. We have always been tested on these areas, even before the MLA content map. There's only minor changes, maybe all the scenarios moving out, newer scenarios coming in. But until May, for the Plab 2, even that is unlikely to change. And so we will focus on what we already have been focusing on, because the areas being tested in the UK MLA are still the same areas that were being tested in the Plab 2. That is your readiness for safe practice, that is managing uncertainty. For example, uncertainties over diagnosis, prognosis, knowing when to call for help, and delivering patient-centered care by listening, hearing patients' values, by taking into account a frail patient, or take into account comorbidities, or the fact that someone might be homeless. And so the social context of these things can matter when managing patients. And this is what we want to pay attention to, outside of just reaching a diagnosis, outside of just making sure we do the basis. We also have to see how we can evolve and include our patients. And the main way we do that, I need to tell you right now, delivering patient-centered care means to define a diagnosis for your patient It means to tell them about their risk factors and to then ask them how they feel about making some of the changes that you suggest, and doing this in a way which is including them. This is patient-centered care. It's nothing new, okay? Because you'll do it every single day. As soon as we do all the different scenarios, you're going to see how we apply these things. Now, to be able to deliver patient-centered care, you have to know how to use communication tools. So you'll hear a lot about ICE, ideas, concerns, expectations. What does that do? It allows you to listen and hear the patient's values. It allows you to listen to the difficulties the patient might have. Doctor, I'm very busy. I don't have time to, cook at home. You're telling me to exercise. I can't go to the gym. I've got a lot of stress in my life. Okay, I hear you. I can see that it's very difficult to make some of these lifestyle changes. I was hoping I can suggest a few things that you can incorporate into your daily life that can maybe help. And, we can always follow up and see other ways that we can change these things. So, sometimes if you're too busy to go to the gym, I just want you to know that sometimes walking very, very fast to get your heart rate up counts as exercise. And you mentioned that you don't have time to cook at home. So I just want you to know that when you order things, or when you order from outside, you can try to choose the healthier options, grilled foods instead of fried foods and things like that. These can really make a difference. So you gave advice based on the patient's concerns, based on the listening and the hearing of the patient when you ask them, do you think you'd be able to make some lifestyle changes? Can you tell me a bit more about your diet? You're listening, you're hearing. Let's move forward. The readiness for safe practice is basic understanding of how to manage emergencies or any acute health issues, but also chronic health and well-being issues. So if somebody has polymyalgia rheumatica and you need to follow them up regularly, you should know how to counsel and check on their health, check on the side effects of the steroids and things like that. So we'll do a lot of things during the course. And I want you to know that everything is part of the themes being tested. And so the 6 domains are not anything new or scary. They cover the areas of clinical practice, mental health, surgery, the usual. And then it includes another domain known as patient presentations. And patient presentations is basically any presenting complaint. And the 3rd domain is conditions. And these 3 domains, they overlap. That is because a patient may present with a shortness of breath, and the condition could be pulmonary embolism, and this belongs to an area of clinical practice. And so this is basically the same as before. It's nothing new. So these 3 domains overlap. The 4th domain is clinical and professional capabilities. This will include your practical skills, which is the 5th domain. Okay, it overlaps practical skills and procedures, and also how to safeguard vulnerable patients, recognizing and managing abuse and other kinds of scenarios. And we will make sure we do all of those in the 10 days as well. The final domain is areas of professional knowledge. Think about ethics and the ethical scenarios, capacity, confidentiality, and reasonable requests, things like that. Good. So the standard types of questions and scenarios won't change. Okay, and the MLA content map will be rolled in by the 17th of May, 2024 for Plab 2. And so these are the key takeaways that I have for you. We don't need to overthink too much in any of these situations. We will be okay. Now, what is the Plab 2 exam? The Plab 2 exam is about delivering information. It is about being a safe doctor, but I need you to know, please do not think you need to commit. You need to commit. When you are in the station for 8 minutes, you will commit to your approach. You will commit to the behaviors expected, and you will be open and honest. A very common question is, what if I don't know the diagnosis? What should I do? Well, you should articulate your suspicions. You should give an appropriate range of differential diagnoses because you are being examined on how safe you are. And so you should take the safest steps possible at all times, including calling for help. 16 stations, 2 rest stations, total 18. I think most of us may already know how the Plab 2 is examined, but I'm going to make sure that I cover that as well. It's in Manchester only. Your exams run usually from Tuesday to Saturday with a few changes depending on the season, if there's any holidays or things like that. But generally Tuesday to Saturday, and the duration is 3 hours. So remember, it can actually be very tiring. You will really need those 2 rest stations. And when you are inside the rest stations, my advice to you is to do what you should do, which is to remain calm, take deep breaths, and continue to tell yourself only good, positive things. Do not think about any scenario in the past. If you did good, if you did bad, it doesn't matter anymore. The only thing that matters is the next station. So, how is your exam marked? Well, the format is an OSCE. You will have 3 people inside the room, and the examiner will be one of those 3 people. The marking system will be a borderline regression. And so you have to pass 10 stations, but you also need to reach the overall pass mark as well. You will have 1.5 minutes of not only reading time, but movement time from one station to another, which can take 15 seconds to 30 seconds. So you really have 1 full minute to prepare when you think about it. 8 minutes of station time begins as soon as you enter the room. Your time begins. When you're saying your name and you're saying your GMC number, your time is still running. And so you have to make sure you know how to make the best of the 8 minutes that you have. And this is also a big part of the course. We will make sure that we do simulations and that we show you how it's done and how you can manage your time. And it's important that you also see how simulators are likely to answer your questions, and we will go through those things. The general distribution of scenarios. It doesn't need to be very difficult. I'm just going to give you a quick rundown of the types of situations you can find each and every single one. Mannequins and teaching, talking mannequins, history taking, telephone and videos, including how to approach telephone and video consultations, counseling and examinations, and talking to colleagues, ethics. Well, let's start with telephones. For telephones, everyone, including the examiner, will be on the phone assessing you. Only you will be in the room. Only you will be inside the room, and there's a video camera that can see you, maybe see your body language, and even check that you are, and can even check that you are confirming the details of the patient. Sometimes the findings will already be available on the table. Always introduce yourself and say your GMC number. You don't need to touch the phone. It's already connected. And the information to confirm, such as the patient name, date of birth, first line of the address, is already available in the cubicle for you. So please make sure you check them and that you actually look at the paper. If you are talking to a relative, you may not need to confirm their age, but you definitely must confirm the relationship to the patient and the patient's age. Don't say, how are you related to my patient in Breaking Bad News? Use the patient's name. Use the patient's name because you should know the names of the patients and confirm the relationship. We'll talk more about that when the time comes. Video stations are same as telephonic, but you can see the patient on the screen. And so that is not a big problem either. How to do examinations in a telephone or a video consultation. We are remote. And so it's important you understand that because we are remote, we only ask them to come for further assessment, or we send them to the hospital or anywhere else if the symptoms say so. You can already have findings sometimes or pictures in the room, maybe a picture of a skin lesion or a rash or the observations that were done before. What you need to do is that you need to see if the patient needs further assessment, and then you will arrange for a further assessment, either face-to-face or send them to the right place if you suspect that they are having a heart attack over the phone, you would call an ambulance for them and you would send them to the hospital and you would stay on the line until the ambulance arrives. So remember those kinds of things. You are just being a safe doctor. Don't unnecessarily exam patients when it's not indicated. If it's a simple viral flu or a simple UTI, you may be able to electronically prescribe the medication for them and they can go to the pharmacy and then they can take the medication that was prescribed. So you'll let them know, I'll prescribe the medication for you. You can go to the pharmacy, and that's very simple. Sometimes a viral flu doesn't need any prescriptions, just advice.